Which statement below about the interrelationship between delirium and dementia is true? A. Delirium is a risk factor for the development of dementia. B. Fully 2/3 of cases of dementia occur in patients with delirium. C. The vulnerability of the brain in patients with dementia may predispose the patient to delirium. D. Dementia contributes to a loss of independence among patients with delirium. E. Dementia can alter the course of an underlying delirium. The answer is C. Delirium and dementia are closely related conditions. The main risk factor for delirium is dementia, not vice versa. Delirium can change the course of underlying dementia, causing functional deficits to advance more quickly and to have harsher long-term effects. Alzheimer's dementia is A. Associated with hypoactive levels of acetylcholine. B. Associated with pathognomonic neurofibrillary tangles. C. More common in men. D. Linked to chromosome 7. E. A clinical diagnosis. The answer is A. Not chromosome 7, but chromosomes 1, 14, and 21. Alzheimer's disease has been linked to these chromosomes. There are neurofibrillary tangles in Down syndrome, dementia pugilistica, and the Parkinson dementia complex of Guam in addition to Alzheimer's disease. Creutzfeldt-Jakob disease is characterized by A. Rapid deterioration. B. Myoclonus. C. Diffuse, symmetric, rhythmic slow waves and sharp spikes in EEG. D. Post-mortem definitive diagnosis. E. All of the above. The answer is E. An infection called Creutzfeldt-Jakob disease results in dementia that progresses quickly. Clinical signs and symptoms change as the illness worsens and rely on the parts of the brain that start to be affected. Age at onset, though it can happen at any age, is typically in the 6th or 7th decade of life. Within 6 months to 2 years of commencement, death frequently follows. The core features of dementia with Lewy bodies include A. Disturbance of consciousness. B. Recurrent detailed visual hallucinations. C. Cognitive decline caused by cerebrovascular disease. D. Progressive language dysfunction. E. Gradual changes in personality. The answer is B. Neurodegenerative dementia, known as dementia with Lewy bodies, is characterized by gradual cognitive deterioration severe enough to impair daily activities. For a clinical diagnosis to be made, at least one core feature must be present, while 2 core features increase sensitivity. Transient global amnesia. A. Is more common in women. B. Is more common in young people. C. Is associated with loss of self-identity. D. Has a characteristically abnormal EEG pattern. E. Has been linked to vascular instability. The answer is E. An illness known as transient global amnesia is characterized by the abrupt development of both retrograde and profound anterograde amnesia. Men are more likely to develop it than women, and it usually happens after age 50. About 15% of cases have a migraine relationship, which raises the etiological possibility of vascular instability. Which of the following is a true statement about Parkinson's disease? A. It is the result of the degeneration of the substantia nigra, globus pallidus, putamen, and caudate. B. It cannot be distinguished from Parkinsonian syndromes that arise from a variety of causes. C. Dementia is more common in early-onset disease. D. It is a prototype of a cortical degenerative disease. E. The only cells affected are those containing dopamine. The answer is A. Degeneration of subcortical structures, principally the substantia nigra but also the globus pallidus, putamen, and caudate, leads to Parkinson's disease. Basal ganglia dysfunction is probably all that medication-induced Parkinsonism entails. Clinical characteristics of vascular dementia. A. Are the same regardless of the area of infarction. B. Are the same regardless of the number of infarctions. C. Are the same regardless of the type of vasculature involved. D. Are the same regardless of whether or not deficits accumulate or resolve quickly after small strokes. E. None of the above. The answer is E. The clinical characteristics of a vascular dementia depend on the area of infarction. Single infarctions may result in the discrete loss of one particular function, example language, without dementia per se. Some strategically located infarctions can affect more than one domain of cognitive function and mimic the clinical picture of a global dementia. Huntington's disease. A. Is linked to the long arm of chromosome 4. B. Is associated with boxcar ventricles on brain scanning. C. Is not usually associated with emotional symptoms. D. Shows striatal hypermetabolism on positron emission tomography, PET. E. Affects men only. The answer is B. A single autosomal dominant gene on the short arm of chromosome 4 causes brain atrophy and degeneration in Huntington's disease. It affects both men and women equally and is passed on by a single gene. Irritability, sadness, psychosis, and other emotional problems frequently manifest early. The criteria for mild cognitive impairment includes all of the following except A. Memory complaints. B. Objective memory impairment. C. Preserved general cognitive function. D. Intact daily living activities. E. Dementia. The answer is E. The criteria proposed by the Mayo Clinic Alzheimer's Disease Research Center, MCADRC, for mild cognitive impairment are 1. Memory complaint, preferably qualified by an informant. 2. Objective memory impairment for age and education. 3. Preserved general cognitive function. 4. Intact activities of daily living. And 5. Not demented. Which of the following is a prion disease? A. Creutzfeldt-Jakob disease. B. Variant Creutzfeldt-Jakob disease. C. Kuru. D. Fatal familial insomnia. E. All of the above. The answer is E. A collection of related illnesses known as prion diseases are brought on by a transmissible protein known as a prion. Creutzfeldt-Jakob disease, CJD, and Gerstmann-Straussler syndrome are included in this group, GSS. Mad cow disease, commonly known as a CJD variant, VCJD, first surfaced in the UK in 1995. The brain depicted in Figure 10.1 shows frontal and temporal atrophy associated with frontotemporal dementia. Which of the following statements is true? A. PIC bodies are found in all the frontotemporal dementias. B. Pick's disease has its own separate diagnostic criteria in the DSM-4TR. C. Frontotemporal dementia is more likely to affect older populations. D. Progressive non-fluent aphasia is a frontotemporal dementia. E. Genetic linkage to chromosome 9 has been found in frontotemporal dementia. The answer is D. Pick's disease-related dementia falls under the heading of dementia brought on by other general medical diseases. Although there is a genetic relation to chromosome 17, not 9, the cause is still unknown. Younger populations are more susceptible to frontotemporal dementia. True statements about Alzheimer's disease include all of the following except A. The age at onset is earlier in patients with a family history of the disease. B. Brain imaging studies are used to exclude other identifiable causes. C. The early onset type may have a more rapidly progressive course. D. There is clear phenomenological separation between early onset and late onset cases. E. No features of the physical examination or laboratory evaluation are pathognomonic. The answer is D. There are no pathognomonic physical or laboratory findings for dementia of Alzheimer's kind. There is no phenomenological distinction between early onset and late onset cases. The optimum application for brain imaging examinations is to rule out other apparent explanations. Factors that predispose to delirium include all of the following except A. Vision impairment. B. Use of bladder catheterization. C. Smoking history. D. Age older than 60 years. E. Abnormal glucose level. The answer is D. Age over 70, not 60, is a risk factor for developing delirium. Other factors include hypertension, abnormal total bilirubin, smoking history, use of an epidural, morphine, or intravenous dopamine, as well as other medical disorders. Which of the following statements about delirium is true? A. It is independent of age. B. It has no bearing on overall patient prognosis. C. Male gender is an independent risk factor. D. Post-cardiotomy patients rarely develop delirium. E. Few hospitalized medically ill patients develop delirium. The answer is C. Delirium is a poor indication for the future. An important risk factor for its development is advanced age. More than 90% of patients who have undergone a post-cardiotomy experience delirium. Patients 65 years of age and older have 3 times the rate of institutionalization as younger patients. The most common cause of delirium within 3 days postoperatively in a 40-year-old man with a history of alcohol dependence is A. Delirium tremens. B. Infection. C. Pain medication. D. Postoperative pain. E. Stress of surgery. The answer is A. If left untreated, alcohol withdrawal delirium is a medical emergency that causes fatality in roughly 20% of patients. It typically manifests on the 3rd day of hospitalization in a patient who is unable to access alcohol and abruptly quits drinking. Stress is a different, less frequent factor, particularly after major operations like heart or organ transplants. Which clinical features may be associated with delirium? A. Disorganized thought processes. B. Hallucinations. C. Illusions. D. Mood alterations. E. All of the above. The answer is E. Delirium is a condition that has unpredictable variations in intensity, a rapid onset, a quick onset, changed awareness, disordered attention, and impaired cognition. Disorganized cognitive patterns, perceptual issues like illusions and hallucinations, and irregular sleep-wake cycles are all characteristics of delirium. Which of the following drugs is best used to treat acute delirium? A. Amobarbital, Amitel. B. Chlorpromazine, Thorazine. C. Diazepam, Valium. D. Haloperidol, Haldol. E. Physostigmine salicylate, Antilirium. The answer is D. Butyrophenone haloperidol, Haldol, is the best option. Avoid benzodiazepines with lengthy half-lives, like diazepam, Valium. In individuals who are delirious, sedatives can exacerbate cognitive disarray. Physostigmine salicylate, Antilirium, may be recommended for anticholinergic toxicity. In delirium. A. Epinephrine is hypothesized to be the major neurotransmitter involved. B. The major pathway implicated is the dorsal tegmental pathway. C. The electroencephalogram, EEG, usually shows diffuse background quickening. D. There is hyperactivity in the nucleus accumbens. E. The level of consciousness is preserved. The answer is B. The main area controlling attention and arousal is the brainstem. There is no activation in the nucleus accumbens during delirium. A typical widespread slowing of activity can be seen on the electroencephalogram. Altering consciousness is a critical element of delirium. Mr. E. is 68 years old and married with 2 children. His wife reports changes in his memory and behavior over the past 9 years. She reports that he frequently forgets his keys, he goes into the house to get something and then forgets what he wants, and he has changed from an outgoing pleasant person to one who avoids conversation. She says that he seems hostile at times for no apparent reason. Mr. E. is in good general health, taking no medications, and his alcohol consumption is limited to 2 to 3 beers a day. What may you observe on examination of Mr. E? A. A grasp reflex. B. Paranoid delusions. C. Pathological crying. D. Poor hygiene. E. All of the above. The answer is E. Patients with dementia frequently ignore the norms of social behavior. There might be primitive reflexes like the grab, snout, suck, tonic foot, and palmamental reflexes. They could cry or laugh erratically without any obvious cause. In the case described above, what is the most likely diagnosis other than dementia for Mr. E? A. Chronic paranoid schizophrenia. B. Delirium. C. Factitious disorder. D. Major depression. E. Normal aging. The answer is D. It might be challenging to separate dementia symptoms from cognitive impairment linked with depression. Significant cognitive decline is not always related to aging. Rapid onset, short duration, fluctuating cognitive impairment, nocturnal exacerbations, and visible disturbances in attention and perception are all characteristics of delirium. Which of the following would be consistent with the progression of Mr. E's illness? A. Frequent nighttime pacing. B. Increased agitation. C. Physical threats toward his wife. D. Urinary incontinence. E. All of the above. The answer is E. The typical course of dementia begins in the patient's 50s or 60s and involves a slow decline over 5 to 10 years. Increased agitation, frequent emotional outbursts, and poor sleep are symptoms of illness progression. Patients who are in the latter stages of dementia turn into lifeless shells of who they once were. The EEG shown in Figure 10.2 is an example of A. Partial seizure. B. Grand mal epilepsy. C. Petit mal epilepsy or absence seizure. D. Psychomotor epilepsy. E. None of the above. The answer is C. Petit mal epilepsy, often known as an absence seizure, is characterized by a distinctive, bilaterally synchronous, 3 Hz spike and wave pattern in the EEG and is frequently readily brought on by hyperventilation. The temporal lobe has a specific seizure focus, according to the EEG. True statements about the epidemiology of dementia include all of the following except A. The risk for vascular dementia is 6 times greater than that for Alzheimer's disease among people older than 75 years. B. there appears to be a higher rate of vascular dementia in men, and a higher rate of Alzheimer's disease in women. C. In geriatric psychiatric populations, Alzheimer's disease is much more common than vascular dementia. D. The estimated prevalence in a population older than age 65 years is consistently reported to be about 5%. E. Dementia of the Alzheimer's type is the most common dementing disorder in North America, Scandinavia, and Europe. The answer is A. Dementia of the Alzheimer's type becomes more common with increasing age. Among persons older than 75, the risk is 6 times greater than the risk for vascular dementia. The estimated prevalence of dementia in a population ages 65 years or older is 5% to 10%. Delirium. A. Has an insidious onset. B. Rarely has associated neurological symptoms. C. Generally has an underlying cause residing in the central nervous system. D. May be successfully treated with lithium. E. Generally causes a diffuse slowing of brain activity. The answer is E. On the EEG, delirium typically results in a diffuse slowing of brain activity that may help distinguish it from sadness and psychosis. A delusional patient's EEG occasionally reveals focused areas of hyperactivity. Typically, delirium does not have a central nervous system-based root cause, CNS. Of the following cognitive functions, the one most likely to be difficult to evaluate and interpret on formal testing is A. Abstraction. B. Calculations. C. Memory. D. Reading and writing. E. Visuospatial and constructional ability. The answer is A. It may be difficult to properly evaluate a patient's performance when anomalous in activities like proverb interpretation. When assessing cognitive abilities, the doctor should look at the patient's memory, visuospatial and construction skills, reading and writing skills, and arithmetic skills. It is important to evaluate one's capacity for abstraction. Amnestic disorders. A. Are invariably persistent, lasting at least 1 month. B. Are defined by a better memory for remote events than recent ones. C. Do not typically impair the ability to immediately repeat a sequential string of information, example digit span. D. Typically have a gradual onset. E. None of the above. The answer is C. Amnestic disorders may be transient, lasting for several hours to a few days, as in transient global amnesia, or persistent, lasting at least 1 month. Head trauma, vascular events, and specific types of neurotoxic exposure, example, carbon monoxide poisoning, may lead to acute mental status changes. Amnestic disorders. A. Are secondary syndromes caused by primary etiologies. B. Are most often caused by nutritional deficiencies related to chronic alcohol dependence. C. May be diagnosed in the context of delirium. D. May be diagnosed in the context of dementia. E. None of the above. The answer is A. Amnestic diseases are characterized by acquired impairment in learning and memory for new information. The disability must be significant enough to impair one's ability to operate in their personal, social, or professional life. If a memory impairment occurs in the context of a decreased capacity to focus and shift attention. True statements about vascular causes of dementia include A. Approximately 15% of cerebrovascular disease is caused by cerebral hemorrhage related to hypertension. B. It is believed that tissue damage in infarction underlies vascular dementia. C. The most common cause of cerebral infarction is thromboembolism from a large vessel plaque. D. It comprises the second most common cause of dementia. E. All of the above. The answer is E. Cerebral vascular disorders rank as the second most frequent cause of dementia. Ischemia and infarction can also be brought on by anoxia, brought on by cardiac arrest, hypotension, anemia, or sleep apnea. About 15% of sickness is caused by cerebral bleeding, brought on by hypertension or an arteriovenous malformation. Frontal lobe degeneration is associated with A. Apathy, B. Disinhibition, C. Lack of insight, D. Social misconduct, E. All of the above. The answer is E. Frontal lobe dementias are not yet formally included in DSM-4-TR or ICD-10 due to their debatable status as discrete clinical and neuropathological entities. Damage to the frontal lobes is a hallmark of frontal lobe dementias, which also feature substantial personality and behavioral alterations. Risk factors for the development of delirium include A. Increased severity of physical illness, B. Older age, C. Pre-existing dementia, D. Use of anticholinergics, E. All of the above. The answer is E. The epidemiology of delirium in non-patient, non-institutionalized groups is little understood. Delirium is a common reason for psychiatric evaluation in general hospitals. However, the referring doctor frequently doesn't recognize it as such. Increased physical sickness severity, advanced age, and baseline cognitive impairment are risk factors. Bovine spongiform encephalopathy is associated with all of the following except A. Amyloid plaques, B. Astrocyte proliferation in the cerebral cortex, C. Bullseye rash on the thigh, D. Neuronal loss, E. Spongiform vacuolization. The answer is C. Bovine spongiform encephalopathy is also known as subacute spongiform encephalopathy because of shared neuropathological changes that consist of 1. Spongiform vacuolization, 2. Neuronal loss, and 3. Astrocyte proliferation in the cerebral cortex. Amyloid plaques may or may not be present. A characteristic bullseye rash is found at the site of a tick bite and is not associated with bovine spongiform encephalopathy. Which of the following statements about psychotic symptoms in dementia is false? A. Psychotic symptoms usually occur in the early stages of illness. B. Psychotic symptoms often co-occur with behavioral disturbances. C. A common early psychotic symptom is paranoia. D. Patients may see deceased relatives. E. Psychotic symptoms can lead to aggression. The answer is A. In dementia, psychotic symptoms typically appear in the middle stages and frequently coexist with behavioral disorders. Having trouble with short-term memory and losing things might lead to paranoia. Agitation, hostility, and behavioral abnormalities can occasionally result from psychotic symptoms. A 77-year-old widower presents for a routine health checkup, accompanied by his daughters. His medical history is significant for diabetes, hypertension, and peripheral vascular disease. 8 months ago, he had a stroke and still experiences left leg weakness. His daughter reports that her father sometimes does not remember to call her back and forgets to take his diabetes medications at least once a week. Once in a while, the patient is noted to word hunt during conversations. The patient insists he is fine and that he drives places without getting lost, does his own grocery shopping, and is never in a bad mood. The patient visits his best friend once a month. He admits that occasionally he has difficulty falling asleep. Which of the following is the most likely diagnosis? A. Depression. B. Alzheimer's dementia. C. Frontotemporal dementia. D. Vascular dementia. E. Normal aging changes. The answer is E. The patient's memory problems don't seem to affect how he interacts with others. Ataxia, dementia, and incontinence are the three symptoms that define normal pressure hydrocephalus. Executive function loss and significant personality changes are hallmarks of frontotemporal dementia. When vascular dementia first manifests, cognitive performance will gradually decline. Directions. Each set of lettered headings below is followed by a list of numbered phrases. For each numbered phrase, select A. If the item is associated with delirium only. B. If the item is associated with dementia only. C. If the item is associated with both delirium and dementia. D. If the item is associated with neither delirium nor dementia. Catastrophic reaction. The answer is B. Associated with dementia only. Decreased acetylcholine activity. The answer is C. Associated with both delirium and dementia. Hallucinations. The answer is C. Associated with both delirium and dementia. High mortality rate. The answer is A. Associated with delirium only. Insight present. The answer is D. Associated with neither delirium nor dementia. Sundowning. The answer is C. Associated with both delirium and dementia. Dementia often has an insidious start, whereas delirium has episodes of consciousness clouding. Drowsiness, confusion, ataxia, and unintentional falls are the hallmarks of sundowning right before bedtime. Both diseases cause cognitive decline, although dementia's alterations are more consistent over time. Directions. Each set of lettered headings below is followed by a list of numbered phrases. For each numbered phrase, select A. If the item is associated with cortical dementia only. B. If the item is associated with subcortical dementia only. C. If the item is associated with both cortical dementia and subcortical dementia. D. If the item is associated with neither cortical dementia nor subcortical dementia. Huntington's chorea. The answer is B. Associated with subcortical dementia only. Alzheimer's disease. The answer is A. Associated with cortical dementia only. Early decline in calculation, naming, and copying skills. The answer is A. Associated with cortical dementia only. Language is relatively spared. The answer is B. Associated with subcortical dementia only. Presenting symptoms more likely to be a personality change or mood disturbance. The answer is B. Associated with subcortical dementia only. Presenting symptoms more often reflect cognitive impairment. The answer is A. Associated with cortical dementia only. Clinical descriptions of dementia have identified two fundamental patterns. Slower cognitive processing is a hallmark of the subcortical pattern. Memory and gnostic practice skills like language, visuospatial skills, math, and motor praxis are all affected by the cortical layout. Patients with subcortical dementia have trouble picking up new motor skills or difficult psychomotor tasks. Directions. Each group of questions below consists of lettered headings followed by a list of numbered phrases or statements. For each numbered phrase or statement, select the one lettered heading that is most associated with it. Each lettered heading may be selected once, more than once, or not at all. A. Dementia caused by Huntington's disease. B. Dementia caused by HIV disease. C. Dementia caused by Parkinson's disease. D. Dementia caused by head trauma. E. Dementia caused by Creutzfeldt-Jakob disease. This is the third most common dementia in individuals younger than age 50 years. The answer is D. Dementia caused by head trauma. The incidence has been reduced because of highly active antiretroviral therapy. The answer is B. Dementia caused by HIV disease. The disease is transmitted by a mutation on chromosome 4. The answer is A. Dementia caused by Huntington's disease. This is a subcortical dementia with slowed processing speed. The answer is C. Dementia caused by Parkinson's disease. The only treatment is supportive care. The answer is E. Dementia caused by Creutzfeldt-Jakob disease. The third most frequent cause of dementia in people under 50 is dementia brought on by head trauma. The physical and cognitive damage caused by human immunodeficiency virus type 1, HIV-1, can range from mild alterations to overt dementia. Directions. Each group of questions below consists of lettered headings followed by a list of numbered phrases or statements. For each numbered phrase or statement, select the one lettered heading that is most associated with it. Each lettered heading may be selected once, more than once, or not at all. A. Creutzfeldt-Jakob disease. B. Huntington's disease. C. Multiple sclerosis. D. Neurosyphilis. E. Normal pressure hydrocephalus. Death occurring 15 to 20 years after the onset of the disease, with suicide being common. The answer is B. Huntington's disease. Death occurs within 2 years of the diagnosis. The answer is A. Creutzfeldt-Jakob disease. Manic syndrome with neurological signs in up to 20% of cases. The answer is D. Neurosyphilis. Treatment of choice is a shunt. The answer is E. Normal pressure hydrocephalus. More prevalent in cold and temperate climates than in the tropics and subtropics. The answer is C. Huntington's disease. The tertiary form of syphilis that affects the brain can produce neurosyphilis, a chronic type of dementia and psychosis. A normal cerebrospinal fluid, CSF, pressure and enlarged ventricles are indicators of normal pressure hydrocephalus. Diffuse multifocal lesions in the central nervous system's white matter are a hallmark of multiple sclerosis.